So the first breathing technique I'm going to walk you through is deep breathing. Now it may sound as if I'm oversimplifying that because everybody can do deep breathing. But what I find often with my clients is that when I ask them to take a deep breath, they go, and it's a really quick in-breath and a quick out-breath, and the shoulders are rising as opposed to the chest filling. So a good deep breath means that when I breathe in, I'm really filling the lungs and I feel the lungs expanding. So in other words, my chest is going to expand, and that is what will cause my shoulders to rise up. And I'm mindfully breathing in and feeling the expansion of the lungs and the chest. And when I exhale, I am mindfully exhaling and slowly emptying the lungs. So this is the most simple form of breathing, and belly breathing, directed breathing, birth breath, all of these build on deep breathing. So I encourage you to start off with this one and get really comfortable with it, because once you're comfortable with deep breathing, then all the rest are really easy to do because you're just expanding that awareness. So in order to do deep breathing correctly, I encourage you to make sure that the shoulders are nice and relaxed. Roll them around a few times. Make sure that your hands are resting comfortably in your lap, and drop the shoulders away from the ears. You can use the app because it gives you a guideline for breathing in and breathing out. And to start off with, I'm going to use the 2-3 setting just to get into the rhythm. So it means that I'm breathing in to the count of 2 seconds and I'm exhaling to the count of 3 seconds. Making sure that when I breathe in, I am feeling the lungs expanding. And when I'm breathing out, consciously emptying the lungs really slowly, almost to the count. So breathing into the count of 2 and out to the count of 3. Into the count of 2, notice how my chest is expanding. And out, chest coming in. Now if you want to, keep the hands on the chest as you breathe in. And feel the chest expanding, exhale, and chest moving back in towards the spine. And do that a couple of times till it feels really comfortable. And then you can step that up and go to 4-4, breathing into the count of 4. Through the nose, exhale, to the count of 4, making sure that those shoulders aren't going. And try and keep those shoulders as relaxed as possible. And do that a couple of times before until you get comfortable. When you're breathing out, try and make sure that the mouth and the jaw are soft and relaxed. So a really soft, open mouth. And it helps if you make that gentle H sound at the back of your throat. We call that Ujjayi breathing in yoga, or the warrior breath. And it will really help you in labor because it will form another form of distraction. Now, when you're going to use this deep breathing is in labor, but I encourage you to practice it every time you feel a Braxton Hicks contraction. Now, Braxton Hicks are essentially those practice contractions, and they start around about 26 weeks of pregnancy. If you're already further and you think, wow, I haven't had these before, you probably have, but you haven't been noticing them, or you've put them down to just the belly muscles tightening in response to your baby moving, because very often it is the baby moving and kicking that cause the belly muscles to tighten, and you think, well, it's just my baby moving. But actually, that movement of the baby and various things that happen throughout the day will cause the muscles to gently contract, and that's essentially the muscles practicing for when you go into labor and they are getting used to what they need to do. And the way that you will experience it is not as a sensation or pain. It's just a hardening of the belly, a tightening of the belly, and very often changing shape, especially as the pregnancy progresses. You'll notice that your belly either comes forward in like a triangle or veers off to one side. All of those would be completely normal, and it's just a Braxton Hicks contraction. And although it's not painful or it doesn't involve any sensation, I still encourage you to use them as a time to practice the breathing. So your muscles are practicing for labor, so that's a time for you to say, oh, I'm going to quickly practice my breathing techniques. So tuning into what's happening in your body, place your hands on your belly, feel that tightening and hardening and difference in shape. close your eyes and do a couple of deep breaths. And even if it only lasts for 20 or 30 seconds and you only get 3 or 4 breaths in, it's still a practice. It's still getting into the mindset of when I feel changes in my belly, I immediately change my breathing and become consciously aware of what's going on in my body and breathing into that sensation. And when you get to directed breathing, you'll see how I'll be using that even more intensely. But start off with just simple deep breathing.